Hi, and thanks for watching Disruption Discussions, Hexagon Safety and Infrastructure and Geospatial's Division vodcast series. And I'm your host, Jack Williams. Everyone knows emergency response is a high-stress occupation. Lives are at stake, and effective decision-making in fast-moving scenarios often determines the success of outcomes. Given the trauma that this can entail, mental health is an increasing concern amid emergency response workers. And fortunately, awareness around mental health and well-being for public safety workers is growing. In addition, as technology has evolved, advancements have emerged for alleviating that stress that's placed on that frontline public safety personnel and staff of all disciplines, with a special emphasis on the often neglected call center staff. And in this episode, I'm delighted to have Dr. Michelle Lilly, an associate professor of clinical psychology at Northern Illinois University, to talk to her about how public safety agencies can enhance the overall mental health and well-being of their frontline employees. Dr. Lilly, welcome to Disruption Discussions.
All right. Thank you for having me. I'm excited. You guys don't know, but apparently this is their first recording, so I feel very nervous, but we'll get through.
Well, thanks for joining. And so I guess, first off, if you don't mind, tell us a little bit about yourself, your background, and how you got an interest in this field for our audience.
Yeah. So I'm a professor of clinical psychology at NAU. I've been there since 2009. I have a doctorate in clinical psychology from University of Michigan. And in addition to being a professor, I also I have a clinical practice called Lilly Counseling and Consultation, where I offer evidence-based treatment for PTSD, depression, anxiety for predominantly first responders and their families. I also work with first responder organizations to do organizational assessment to figure out what's going on. Sometimes organizations bring me in to help them have critical and difficult conversations between coworkers. And I really started actually working with first responders in graduate school. I worked on a couple projects with retired police officers, but my background was really in individuals who had experienced intimate partner violence. So when I started in my professorial role in 2009, my first project was with survivors of intimate partner violence, and I had an undergraduate research assistant who joined the lab and was helping me collect data. And we were talking about cops one day. We were kind of talking about cops and kind of police culture and what I had observed. And I indicated that I was always curious to get back into that line of research. She was like, yeah. And then she shared that her husband was a cop. And I was like, oh, wow. Okay. And then she came back a day or two later and said, hey, I don't know if I mentioned this, but I was a 911 telecommunicator for 7 years before I came back to school. And I was like shocked. So she started, because she hadn't mentioned it. And I was like, interesting. And I think the real shocking part for me was that she started then describing the job and what it entails and sitting in front of these monitors and the repetitive nature of the distressing events and kind of understaffing and all of these things. And I just was like, I had no idea, like the general public. So she said, there's also no research on this. So she leveraged some of her former connections. I didn't know anybody in the 911 space at that time. And we published the first study in 2012, looking at PTSD and depression in 911 telecommunicators. The response to that was so big that I just never left. So I'm a lingerer in the 911 industry. They can't get rid of me. So I, have continued to do subsequent follow-up projects. And like I said, clinical work, some consulting work along the way.
So with a heavy emphasis on the call center stress of the call takers, dispatchers, myself, I come from that. I've been in many communities. I think the first time I went to a communication center, I was amazed to see everything going on. I mean, there's a cockpit of monitors.
Yeah.
There's bells and whistles. And, I'm sitting there outside. I mean, I'm just kind of frozen, there's a lot going on. And from the small call centers to the big ones. And it's amazing how, we kind of show up to work every day and we're not dealing with these types of things. And they can't really, they can have bad days, but they got to be on their toes. So I've been very interested in the topic myself. So I'm going to probe you for some information. So.
Yeah. Ask away.
So So, in this line of work, so how does the repeated stress and trauma and 911 telecommunicators, call takers, dispatchers, that call center, emergency communication center, how's the stress and trauma of this repeated activity impact this group of professionals?
Yeah.
What do you see in some of
Yeah.
your research?
Yeah. So our very first study that was published in 2012 showed that PTSD, depression were slightly elevated compared to the general population. Then I was kind of looking at the measures and I'm like, I don't think these are the best measures for this. So we did a follow-up study with 800 telecommunicators from across the country. And we started publishing some of that data in 2015. And what we found is about 17 to 25% of 911 telecommunicators screen positive for PTSD. And that's compared to about 3 to 5% in the general population. So much significantly elevated. Our rate of probable major depression was just under 25%. So just under 25%, 1 in 4 telecommunicators is struggling with major depression. I have baseline data that was collected more recently and actually was ongoing over COVID. I just haven't been able to look at that yet. But those numbers seem pretty consistent. So we collected some baseline data for a peer support program in fall of 2019, so right before COVID. And those rates of depression, anxiety, stress, and PTSD were about consistent with that first study. So these are the numbers that we're consistently seeing. That does not account for, so I'm a clinical psychologist, so I look at clinical disorders like PTSD, depression, anxiety, substance abuse. It does not account for the high levels of burnout. So there's a really high level of burnout. I can speak to that anecdotally in my clinical practice. I think burnout is just as high as these other clinical conditions, and kind of the symptoms of kind of having burnout don't uniquely fit into any of these categories. I see them as being a little bit of PTSD, a little bit of depression. So I think burnout is really high. And then there's a new field of research on a topic called moral injury, which is when individuals witness or feel like they're unable to prevent atrocity. They witnessed or heard things that were counter to their moral beliefs. And there, to my knowledge, I have an ongoing project with that right now, looking at moral injury in 911. We have not received that data yet or started looking at it. But we do know that moral injury is very common in veterans. And there's some preliminary evidence showing that moral injury is elevated in law enforcement. So that really kind of struck me and felt as though I needed to do a project on moral injury in 911.
Wow. So burnout itself, it doesn't really fit into a clinical diagnosis. Like but I mean, how would you describe burnout? Because I feel like I've talked to people and they've said
Yeah.
that I'm burnout. I just don't know what to.
Yeah. Yeah. So yeah, you can't, like, for example, as a clinical psychologist, if somebody came in and they didn't qualify for a diagnosis of like PTSD or depression, anxiety, I can't bill insurance for burnout, right? So it's not technically a clinical disorder yet. Could it be in the future? Maybe. So burnout, how I see it in 911 is just a high level of, this kind of compassion fatigue, like just feeling depleted, feeling as though you've given so much of yourself psychologically and physically. And so it's just kind of this state of depletion that I think affects your motivation, affects your concentration, your attention, and honestly, just kind of caring, right? Kind of caring about the job and wanting to kind of be there, are all really affected. And so I think burnout is just kind of this more pervasive, lingering state of depletion, lack of motivation, and just trouble summoning kind of the internal resources that you need to cope with such a stressful job. So that's how I think about burnout, and how I see it in 911.
So if I'm a call center supervisor or someone in the emergency communication operations center, what are some of the things I should be looking for in terms of signs or tips that there could be some PTSD type of activity, burnout, moral injury? I mean, what are some of the signs people should be looking for in the leadership roles?
Yeah. I think what I usually say is that behavior generally for people does not change a lot right? Like we're pretty consistent over time with how we behave and how we approach things. But when you start seeing people shift in their behavior, and it can go one way or the other, you could have somebody who's like previously very kind of gregarious and outgoing, and if they start becoming more isolated, withdrawn, um, that's a big indicator, right? Because the job is affecting kind of their basic responding, right?
Yeah.
And they might be feeling overwhelmed. They might be having that kind of depletion, so they just can't kind of seem to kind of stay activated in the same way that they maybe were before. So changes in behavior that way. And I also say the trickier one is sometimes behavior change in the other way. Somebody who's maybe a little bit more quiet, a little bit more reticent, if they start kind of acting out or being more chatty or seeming more activated, sometimes that's also a warning sign, right? So but I say the biggest thing to look for is just changes in people's behavior. Now that of course requires you to notice their behavior in the first place and
Yeah. Yeah.
kind of check in and kind of see where they are, so that all of a sudden you're not missing, one day, this person's over here. And call center directors are tasked with an enormous amount of stuff, right?
Yes.
So it's easy to get pulled away from the floor and from the people. So then it can be easy to miss these things. And so even just kind of small check-ins to be present and be around and kind of notice what's happening for your people is critically important.
Yes, I've sat on some panels and had some discussions with other technology folks around employee public safety well-being, and there's the call center is often, oftentimes you think of the first responders, the people out in the field who, as you can see on their body worn camera footage, and just knowing the job, you're going to run into stressful situations, but it's the call center folks that kind of get forgotten.
Yeah.
And so, it's something that, so when I've sat on these panels, everybody's trying to think of are there technologies out there? Are there ideas on maybe ways to help, I don't know, see some of these warning signs so that there could be some sort of, intervention with someone like yourself or someone who's familiar with mental behavior.
Mhm.
Have you seen it? I'm just curious. Are there any pilot programs, studies, things you're seeing out there in the space of people doing this?
Not that
Something
I
to help?
know of. Yeah, I mean, not that I know of. I mean, I am kind of vaguely aware of a potential patent of somebody who, as part of kind of the kind of CAD system, if they're having a distressing event, they can kind of like say, okay, that was bad, right? As a way of kind of tracking kind of the overall kind of trauma load. And then if that person's really struggling, they can, get connected with somebody. So I'm aware that's kind of out there. I don't know how far along that is in terms of development, et cetera. I know that, for example, Mark, the Mid-America Regency Council, and the peer support program that was set up by Pam Apoka, they have like a list of resources right in their kind of system. And so if people are
Okay.
struggling, they can just on their intranet kind of access, list of resources. And I think they can activate peer support from that system. So I've seen stuff like that. And I think that that's really great. It's always really hard because there's so much stigma surrounding mental health and stress reactions. And so I think the first step before we even integrate some of these technologies is thinking about how, of course, you could keep it anonymous and confidential,
Yeah.
and how we can destigmatize mental health in the workplace so that people are willing to say, okay, I'm not okay at this moment. Right.
Yeah.
And what I always say is like, makes sense that you're not okay. You're witnessing human tragedy, right?
Of
As
course.
human beings, we're affected by that. And there's this long-standing history in first responders that you just shouldn't be affected, right? Like you should just be able to push forward and everything will be okay. But we have quite a bit of work to do. I see it coming. I see change coming over time. But to break down some of those walls so that people aren't feeling that internal stigma for saying, I'm not okay, when it's perfectly reasonable that they would be struggling in moments of human tragedy and high
Yeah.
distress.
Yeah. I mean, I would think it would be odd if you didn't. And I guess over time,
Yeah.
though, in repeated types of stress, it can become numb, which at a point you might need to get some peer support. But you do see
Yeah.
people across the landscape out, and the, professional sports industry. You see a lot of these former football players and basketball players talking about their mental health, some of the Olympics folks. So I do think there's a general, I mean, this is just a subjective observation. It does seem like people are more willing to talk about mental health and just realize that hey, we all got something, I mean, let's be real. I mean, there's always these quirks and behaviors, and sometimes they can spiral out of control and really become a big problem. So hopefully that stigma will start to go down.
I see it for sure. I mean, the first conference I ever went to in 2012 with 911, where I was talking about PTSD, I got kind of a chilly reception. I had a lot of people kind of sitting back and glaring at me. I had some people telling me that they thought I was going to like ruin the 911 industry by starting to talk about PTSD, because I was going to everyone was going to start malingering. Everyone's going to go out and disability. I mean, and just a decade later, I was just at the Navigator conference a couple of weeks ago, and people are talking about this in a very real and thoughtful and proactive way. That's been a huge shift in the last 10 years. And I think you're right. I think it's reflective of overall a higher level on a societal level of talking about mental health, and the kind of prevalence of it. It's highly prevalent. A lot of people struggle with mental health.
Yeah, well, I'm glad you're starting the conversation, Dr. Lilly. I think it's something that needs to be done. I mean, there's a saying in the industry: call takers, dispatchers are some of the hardest people to recruit, train, and retain. And I think this is a big element of it. All right, I'm gonna pivot real quick. So now we've got all these. All right, so I'm curious to see how this affects this. So we have a lot of IoT. I don't know if you're familiar with that term, Internet of Things, like sensor data, video data, all this stuff starting to come into the call center more and more. I mean, with next generation, like call handling, you can actually text, send video clips of what's going on. I mean, and obviously, there's just a ton of let's say specifically video type data out there.
Yeah.
How does that affect that specifically, what are some of the positives and negatives that you see of incorporating sort of video, multimedia, imagery into dispatcher work experience? Because I can imagine it could be very helpful, but it could also be very disturbing as well.
Yeah, absolutely. Well, I think we're early enough that we don't really know. I don't know that we can make kind of systematic conclusions about the impacts of these things. And so I recently released a white paper kind of using what we know from the theory and research on things like PTSD to make some predictions about what the impact could be. And so I think starting off with the disadvantages, of course, now 911 telecommunicators are going to see disturbing images. Right. And they're going to see some things that might be really, really upsetting. And so that's going to make it harder. Right. Particularly gruesome calls where if you feel like you weren't able to do anything. So I think that could be a disadvantage. I think there are going to be bad calls. On the flip side, I would actually argue that to the extent that we can better save lives because of the technology and the more information that we have, being able to access information that maybe a caller can't communicate to you because they're distressed or injured or in peril. And to the extent that we can reduce injury and save lives, I think it's going to have a net salutary effect because it's value consistent, right? People go into this job with the goal of helping people and saving lives. And to the extent that you can use that greater information and the technology to do that, I think the less we have some of those troubling emotions like self-blame and guilt and all those things that come about when we feel as though we've failed to prevent something that was so mission critical for us in the first place. So I think that can be very helpful. We also know from the cognitive psychology literature that if you compare people who they have to watch a really grody movie and they can see and hear it versus just hearing it versus seeing it, the people who only hear actually had the highest levels of stress. And that's because our brains do funny, interesting, quirky things when we don't have information. And so I think sometimes our brains get the best of us and start filling in details more catastrophically than may have actually been true. So I think there's a number of reasons to believe that while there are going to be difficult calls and it's going to be transition and dealing with new technologies is always stressful, I think overall there's reasons to believe that some of the doom and gloom around this is unwarranted. And in fact, I think that there could be some real advantages to it from a psychological perspective.
Excellent feedback. Yeah. Interesting about the audio versus audio video.
Yeah.
Now, Justin, I'm glad we switched from just an audio only to video podcast format. That's good. All right. All right. So I know we're running up against the top of the hour.
Yeah.
So I do know you did write a white paper talking about a lot of the things we've been discussing. Obviously, just we've hit on a few of them here. Can you let our audience know how they can follow your work, where they can get access to that and your other materials, and maybe even participate for some of our clients if you're ever looking for some folks to talk to?
Yeah, absolutely. So if you just go to lilly-consulting.com, that's where my stuff is housed. So Lilly Counseling and Consultation, I've got information there on the trainings that I do, the papers that I've published. When I'm doing research, I usually include like a banner on the opening page of like, hey, participate in research. In fact, we have one going on right now with moral injury. So if anybody wants to weigh in on their experiences of moral injury in the workplace, we welcome that. I have a very astute, very smart first-year graduate student who's particularly interested in the concept of moral injury. And so I think this could be really a game changer if we start shedding light on that particular construct and its impacts in the first responder community. So yeah, just go to www.lilly-consulting.com. And
Lilly
everything is there.
All right,
Yeah.
Lilly
Yeah.
Consulting. Yeah, check it out. And I know I've been to a lot of our customers globally. And is most real quick, is most of your research focused in the U.S. or you do some global research as well?
I've only ever done research in the U.S. I am certainly not opposed to doing it in other contexts. It's just, it's a bandwidth issue, right? I do lots of different things. But I am fascinated by the idea of doing more global work because I think that there are probably some pretty interesting and important differences across continents and across various geographical boundaries in terms of how the systems work. Of course, there's varying levels of stigma in different places in terms of talking about mental health. So I'm very interested, just hasn't happened yet.
Okay. As I know some people listening to this are not going to be from the U.S. And you're right. Their version of call centers are a lot more, I would say, very consolidated, very big, larger service areas. But it is done quite differently. Anyways, I just figured I'd throw that out there.
Yeah.
All right. Well, is there anything you'd like to leave us with? Any parting thoughts? Any words of wisdom? And maybe something you want to leave us with before we hang it up?
Yeah. I just feel like there's always so much. I feel like I'm a depressing person because I go around and talk about like trauma and the prevalence of mental health conditions. But I personally just have a lot of hope for this industry because I see a lot of people starting to really engage in critical conversation, think about proactive ways to address mental health. We're not there yet. And there's a lot of variation across agencies and how they're supporting and advocating for their employees. But in just a decade, there's been tremendous change in this industry around thinking about mental health, and I see that continuing. So I have a lot of hope that some of the silent suffering that people have done over the many decades will start to change.
Well, I'm a big believer in what you do, and you do not come across to me as doom and gloom. You come across as very passionate and outgoing, and it's a tough subject to talk about. But I mean, also it's something that needs to be talked about, and I think you do it in a very nice way. And I'm really excited to see your research. I feel like you're just getting started, and there's a lot to learn here, and we'll be following because I do think longer term. I mean, I think there's some tools and some things that the systems can do from technology providers' standpoint that can really assist in this. It's not going to be the single answer, but to assist in employee well-being and overall just job satisfaction and because call center folks, I mean, I say this in a lot of my conversations, they're often not thought of in the context of public safety. They're kind of hidden behind the scenes, and they deal with a lot. Just go to one of these like you have. So, hey, thank you very much, Dr. Lilly. Big thank you. I know you're busy. But I encourage everyone listening to check out our website and let her know if you have any feedback and you want to participate. And with that said, I'd like to say thanks to the audience, and we look forward to having our next conversation of disruption discussions, and maybe we'll have Dr. Lilly back here in a little bit to see how our research is going. So thank you very much.
Thanks for having me.